I'm Margaret Douglas. I'm based in Edinburgh University, where I co-direct the Master of Public Health programme. I'm also an honorary public health consultant with Public Health Scotland, where my particular area of interest is in health impact assessment and social determinants of health. Obviously, the pandemic has placed enormous pressures on health services and social care services and most other public services, in fact, have had a huge pressures placed on them. We're now in a position where the NHS is um, seeing more and more cases again of COVID-19 disease and has to manage those cases. And of course, people who are in hospital or infected with COVID-19, we don't want them to pass it on to other people. So we have to be very careful of infection control within the healthcare setting. Because of the pandemic, many people have had other procedures and operations cancelled. A lot of other routine appointments had to be cancelled so that the NHS could manage the waves of COVID-19. There's now a huge backlog. So that will place a huge amount of pressure on the NHS. And on top of that, of long COVID, which is a new condition. I think there may actually be several different conditions which are all recognised at the moment as long COVID, and we don't really know how to manage those cases. So there's a big research agenda in terms of what is the best way to manage long COVID. There's ongoing management of outbreaks, there's delivering a vaccination programme. All of these things place huge pressure on the NHS. So I think there is a big public health question about how we can support that. But the biggest issue facing the NHS and social care just now is managing the sort of pressure that they've been under and will continue to be under for quite a long time. There have been some good things. So changes to remote consultations, they definitely don't suit everyone, but some people actually have found those very beneficial. And I think there's another sort of research and evaluation question, which is about looking at some of the changes in the patterns of care, some of which perhaps we should keep for the longer term. So as well as the direct mortality and morbidity from the virus and the indirect effect on health services, which means that many people have had deferred care. Many people will have what would otherwise have been avoidable morbidity and quite likely mortality as a result of that. People haven't been able to have essential surgery, for example. As well as that, there have been a lot of other indirect effects of the measures that have had to be put in place to manage the pandemic. One of the most obvious is the effects on people's mental health, both directly the sort of anxiety as a result of living in a pandemic with a life-threatening virus, but also the effect of social isolation. So people have been asked to stay at home. We know that loneliness has adverse effects on not just mental health, but also physical health. And all of the other sort of changes in people's ways of life have all affected their mental health. Some people have had beneficial effects on mental well-being, but I think it's predominantly been negative. And certainly the surveys show that there are increases in anxiety, for example, particularly among young people. We've also seen really significant economic impacts. So particularly in the sort of early part of the pandemic when there was a lot of uncertainty economically. A lot of people lost income because they were unable to work. And the furlough and self-employment scheme didn't fully replace people's loss of income. Some people may lose their jobs as a result. Businesses have folded, and there are really strong links between income and health and between employment and health. So unemployment in particular affects, it's probably intuitive that it affects mental health, but it also affects physical health. And studies have shown that if you become unemployed and don't regain employment, you've got a significant increased chance of dying over the next 10 years compared to somebody who does regain employment. And the people who have suffered most from those are people who were on low incomes and generally had the poorest health to begin with. The requirement for people to stay at home also strained a lot of family relationships, particularly during the sort of most restricted time when people were asked to stay at home pretty much all the time, and people are cooped up at home and people are trying to work from home. That places quite a lot of strain. There's been evidence of an increased risk of both child abuse and domestic abuse during this time, which is very likely related to that. And also the fact that there wasn't really any oversight because people are cooped up at home. If they are being abused, it's much more difficult for them to seek help and more difficult for anybody else to notice what's happening. And then another big impact on children and young people, of course, has been loss of education. Young people have lost a lot of time at school, which affects not just their academic performance, but also their social development. And particularly for very young children, it's very important for them to be in contact with others in order to develop their social skills. And that has definitely been affected by the restrictions that were put in place. But I think what is very likely to have happened is an increase in inequalities, because we know that independent schools and schools in more affluent areas were able to provide online resources much more than schools, more than the state schools, and particularly state schools in more deprived areas. So it's very likely that educational inequalities will have gone up. And that's a concern for health, because there is such a strong link between education and health. But there have been a lot of positive community responses. So most of this is negative, but there have been positive responses that we've seen in communities with local community organisations and individuals offering a lot of support to each other because of all the changes that were made, and because statutory services were unable to meet quite a lot of those needs. I think some of the changes in people's ways of life might continue and could also affect their health either for good or for bad. So we've seen changes in transport patterns. I've been doing quite a lot of work on transport during the pandemic, and we've seen that all journeys went down at the beginning of the pandemic, but the car journeys crept back up much more quickly. And actually the number of car journeys on the road is very similar to 2019 levels now, whereas public transport journeys are way down. And surveys show that people are still very anxious about getting back on a bus or a train. So if that concern continues and those trends continue, it suggests that when restrictions are fully eased, we might actually have a lot more cars on the road, and public transport might become unviable. And there are, again, many adverse effects of high volumes of traffic on health, and lack of public transport is an important cause of transport inequality, which again affects health. So all of these things are likely to have actually quite long-term effects on health. And I think it's important that we try to monitor those and we try to intervene where we can. Most of the adverse effects have disproportionately affected populations that were already in poor health. So the pandemic has increased health inequalities directly because we know that people living in deprived areas are more likely to have had severe disease and died as a result of the virus, but also all of these indirect effects also affect the same groups of people. In the past 10 years or so, we've seen that life expectancy has been stalling, inequalities have been rising, and there are sort of wider threats to sustainability that we've perhaps forgotten a little bit about in the pandemic, but are really going to affect us shortly, like loss of biodiversity and climate change. And all of these impacts are linked. So we need to consider all of these things in quite an integrated way. So during the pandemic, I think public health has been given a much higher profile, which I guess a public health person I would think was a good thing, but it perhaps has been seen as being synonymous with infection control. And as I've just talked about, there are different aspects to public health, and I think it's important that we don't only focus on the infection control aspects. I think there's been other cultural aspects. There's been a lot of uncertainty throughout the pandemic. It's a new condition. We know a lot more about it now than we did at the beginning, but there's still a lot we don't know. And that means the messaging is really very difficult. And people, above all, want certainty. They want to know what's going to happen. And sometimes it's been very hard to provide that. And there's been quite a lot of polarization of views and some obvious deliberate misinformation, which is sometimes used to advance other agendas or is framed according to prior beliefs and values. So for example, there's been a lot of victim blaming of people who are not isolating because they actually can't afford to isolate because they'll lose work and we're not providing enough support to them. I've just placed my own value judgment on that, I realise, but I do think it's important to try and understand the values that underlie some of the messages that are out there about the pandemic. In terms of looking a little bit further forward, I think the sort of long-term effects will depend on a whole lot of things, including what happens next with the virus, how effective the mitigation measures are in preventing transmission, but also what we're doing to mitigate some of these wider impacts that I've talked about. So how well we're protecting people who've lost economically as a result of all of the changes that have been made.